My centre, UCLH, is a specialist referral centre for POEMS syndrome, and our frontline treatment outcomes abstract examined 100 patients from our POEMS registry, and we described outcomes in transplant-eligible and transplant-ineligible patients with systemic POEMS syndrome. So those are patients that have greater than 1 plasmacytoma or evidence of POEMS syndrome on bone marrow biopsy. So looking at the outcomes first in the transplant-eligible population, about 2/3 of the overall cohort were transplant-eligible and underwent melphalan autograft, and the overall progression-free survivals are very encouraging. But we examined the use of induction and versus proceeding directly to melphalan autograft, and found actually that the use of pre-ASCT induction didn't significantly improve the depth of response in terms of hematological response or VEGF responses. And actually the overall survival and progression-free survival using induction and not using induction prior to autograft were similar. So these are the main findings of the autograft cohort. It's a relatively small cohort, it's a rare disease, and it requires further study, but these are our initial findings. And in terms of the transplant-ineligible population, as you might expect, the overall survival and progression-free survival was not as good as in the transplant-eligible population. So overall, we concluded that POEMS syndrome is a disease that responds very well to melphalan autograft in those who are eligible, and that the use of pre-ASCT induction requires further study, but we advise prioritizing proceeding to autograft in those who are fit. Yeah.